While health executives are busy expensing private health care at the Mayo Clinic to the taxpayer, 5-year-old Brooke Aubuchon from Innisfil is dying of a rare disease of the nervous system, the same disease which took the life of her brother Alex in 2011. But there's hope. Brooke qualified for a revolutionary clinical trial in New York that may save her life. Her surgery was on February 26th of this year. Unfortunately, Brooke is not a senior health executive, and the Minister of Health told Brooke's family that the PC government won't cover her expenses. How can the Associate Minister of Health possibly defend this absolutely disgusting hypocrisy?
You know, Mr. Speaker, nothing, as a parent, I have to tell you, nothing can be more difficult to anyone than having a sick child and not being able to help. But at the same time, I have to tell you, Mr. Speaker, that to hear this, the word despicable would be an understatement, because we have been very clear, Mr. Speaker, that the decisions on out-of-province and out-of-country services are made by medical doctors in the best interest of the patient, not by a PC government, not by a Wild Rose opposition, but by medical doctors who know what is the best and what is really possible.
Honourable member.
So disappointing, given that this PC government clearly has set up the worst kind of two-tier health care possible, and given that one tier has Albertans waiting the longest in the country for many medical procedures, if they're even available, and given that the second tier allows for Alberta Health Services executives and members of the government family immediate access to private health care on the public dime, when will this government afford this same opportunity to everyday Albertans?
Mr. Speaker, if we had the choice and the ability, every member on this side of the government would give any child and any parent any ability to send their child anywhere possible. But we all know that that is not realistic, especially when you have an opposition screaming to cut deeper and deeper and deeper. Mr. Speaker, we will always make sure that decisions are made on best medical information available to the benefit of the child or the patient, and that they will not be politicized by government members, by bureaucrats, and opposition who has a tendency to do so.
Honourable member.
Given that 5-year-old Brooke Aubuchon's family has taken on severe financial hardship to pay for what this government gives away to senior health executives, will someone in this government finally do what's right, realize how wrong they are, and pay for Brooke Aubuchon's expenses?
Here. Mr. Speaker, let me restate the obvious. Decisions on sending children or any Albertans to clinics outside of Alberta or outside of Canada are made based on medical information by medical doctors and other allied professionals. These are not political decisions. These are not decisions made by government officials, nor should they ever be.
Member for Calgary.